Hi, welcome back to my channel. In this video, I will be talking about the subclavian artery and its various branches in a very easy way. So first of all, as usual, general, you should know that the subclavian artery, it is basically divided into three parts by the scalenus anterior muscle. All right, then you should remember the three parts and their what are their further branches. So in three parts you can remember it by vit C, D, vitamin C and D. So by V, first we will have vertebral artery, then we will have internal thoracic artery, and by T we will have thyrocervical trunk. All right, then by C we have costocervical. I'll just write it better way. We will have costocervical trunk, and by D we will have dorsal scapular artery. Now let's just talk about it. So first of all, you will I'll just draw a diagram, and so that you will be easily be able to understand it nicely. So first of all, suppose I have a muscle which is, as I told you, scalenus anterior. All right, so I'll just fill it up. So this is the scalenus anterior. I will also discuss about the relations of scalenus anterior in the upcoming video. All right, so this is scalenus anterior. So scalenus anterior, then let's draw the artery. So you have something like this. Okay, now this is first part, this is second part, and this is third part. So for the first part, as I told you, VIT. So first branch is vertebral artery. All right, now you have to remember one thing here. So this is vertebral artery and it traverses to the foramen transverse area from C6 to L1. Then we will talk about second one, which is I. So internal thoracic artery, and third is our thyrocervical trunk. All right, we'll just draw thyrocervical trunk a little smaller. So this is internal thoracic artery and this is thyrocervical trunk. Then coming on to second part, which is our costocervical trunk. So it basically goes like this and then it comes out. All right, and this is costocervical trunk. All right, then from costocervical you can remember the branches if you want to, but there is no need. So there is deep deep cervical artery and highest intercostal artery. It's not needed to know this. Now third branch is from here. Now very important interesting point is third branch is usually not present. It can be absent also. So when it is absent, I'll just tell you dorsal scapular artery. So now I just want to talk about this thyrocervical trunk again. So in thyrocervical trunk, see, this is the thyrocervical trunk and you need to remember its branches. Okay, this is important. So you can remember its branches by SIT. All right, so S, I and T. So from S we have suprascapular artery. By T we have transverse cervical artery, and by I we have inferior thyroid artery. So thing is, sometimes the transverse cervical artery, it is absent. So to compensate its absence, third part of subclavian artery is present, which is dorsal scapular artery. All right, now let's just go through the diagrams. So first of all, let's just see this diagram. In this, see where we have first of all, just see. So this is our common carotid. I'll just decrease the. So this is our common carotid artery. All right, then coming over here, first we have vertebral artery. All right, then we have thyrocervical trunk, this one. Okay, now see the branches of thyrocervical trunk. So transverse cervical artery, okay, then suprascapular artery. All right, then SII, we are finding inferior thyroid artery. So this is inferior thyroid artery. Okay, so okay, this is the thyrocervical trunky branches. Then let's talk about the VIT. So we have to find internal thoracic artery. So yeah, so this is internal thoracic artery. So this is the I'll just draw it with different color. So this is internal thoracic artery. So if you see, this is our first part, right? Then coming on to the next part, second part. Now second part, I told you it is the costocervical trunk. Then let's see the costocervical trunk. So yeah, it's here. So third part, say we are having costocervical trunk. From it we are having deep cervical artery, and we are having superior or highest or supreme intercostal artery. All right, so second part done. Then let's talk about the third part. So third part was vitamin C, D for dorsal scapular artery. So if you see, this is the dorsal scapular artery. They've not mentioned it because usually it's absent only, so that's why. All right, now let's see from here also. So first of all, you should know that we have arch of aorta, right? Arch of aorta. Then you should you should see, then we have the left common carotid artery, right? Then from left common carotid, see, I'll just tell you, we have arch of aorta, right? Then we have left common carotid artery, and this common carotid artery will further form vertebral artery and will form left subclavian artery. But on right side, it's a little different. We have the brachiocephalic trunk. Now from this brachiocephalic trunk, you will see common carotid artery, and then then you will see right subclavian artery. So first you will have the right brachiocephalic trunk. Okay, this. So this is the extra thing that is present on the right side. So okay, so this is right common carotid artery. Now let's talk about the subclavian artery, the limelight. So this is our subclavian artery. So first of all, starting from the vertebral artery. So we have vertebral artery. All right, then we have the thyrocervical trunk, then we have costocervical trunk, right? Yeah, so these are the branches of cervical subclavian artery.